Hello and good morning from Arizona. My name is Dr. Boerwinkle and I'm a neurocritical care physician here at the Phoenix Children's Hospital. And I'm here today with Elijah Sanchez, his father, Victor Sanchez, and his mother, Jeanette Dodge. And we're here to discuss Eli's injury, his coma that he experienced, and the road to recovery that Eli has experienced. And so I'd like to just first start with hearing a little bit from Eli, how he's doing and what you might like to ask him.
Yeah. How are you doing today, Eli? Are you happy you get to be home now?
Are you excited? You're getting interviewed? Yeah? Do you know what an interview is? No? It's where they talk to you about stuff and you get to tell them what you want. Does that sound fun? Is it new?
Fantastic. So I'll just tell the audience listening what did happen to Elijah. That back in April of 2021, you all were in a car and a car accident happened and Elijah was seriously injured. And he came to the Phoenix Children's Hospital where hours after he came, I was his neurocritical care physician in the ICU. And at that point in time, just hours after he'd come in, he had had scans of his brain and his spine. And most unfortunately, they showed a very serious injury to where his skull and his spinal cord meet his skull, that the bones had detached there and that the spinal cord was nearly severed. It was very severe. And the checkout that I got from the physicians who had been taking care of him hours before was that this was a fatal injury and that he is not expected to survive. When I first examined Elijah, he had only one brainstem reflex left, and otherwise he was completely unresponsive on all of his physical exam markers. And that was a small reaction of his pupil on one side. And so it was very clear that he was in great peril. And I actually also did not expect him to survive. However, because he wasn't brain dead due to this exam finding, we launched the panel of tests that we do to get a handle on the brain function. And we can go over those tests now. What's that?
I think we've explained it, the accident to him in general, but I think hearing it from somebody else, it's like, oh, okay, it was, you know, a lot more serious than we could explain.
Yeah. He's a medical miracle. Okay. Let me share my screen. Here we go. And you guys should be able to see the slide if I'm doing this right. Do you see, hopefully, do you see just one slide or do you see several?
We see two.
Okay, let me switch this around. I'm already messing it up. Okay, how about now? Two or one?
Still the two.
Oh, two.
There's a big one on the left and then there's a smaller one on the right, kind of.
Yeah, I am trying it different directions. It wants to keep doing this. Let's see, display settings, swap, there we go. Okay, how about now?
Yeah, that's centered now.
Okay, perfect. So what we're looking at here is the panel of tests that Eli received. And what's new about the test that he got is that he got a task-based functional MRI and a resting state functional MRI, and then all the sort of regular tests, which are the EEG, and then these, more brainstem and basic tests that we'll do sometimes for children in coma. And so what was new about adding the task-based MRI is that we were asking him to do things while he was in a regular MRI scanner. Now, we weren't expecting him to actually move at all because he can't, and he couldn't at that time. But what we were hoping for is to see brain activation. So if we would ask him to move his hand, then the hand network would light up in the scanner. However, during that first week when we did this scan, none of those networks lit up except for his vision network. However, we did see these abnormal networks that you see here in the picture on the left. And those networks that with this red graph is the time of the network signal, and it's very time-based signal. It's very fast and erratic, which to me looked a lot like the children who had severe epilepsy. However, his EEG was not showing seizures. But because everything looks so poor with only one real network showing up and his exam looking so badly, all the team agreed that we would give him some heavy duty seizure medication. And so for 3 days, we gave him some loads of phenobarbital, which is a common medication that we use for children who are in status epilepticus. And for 3 days, he got that heavier dose. And then for a few days after, he got the regular lower dose. And by the second week, his exam had not changed appreciably. And so we decided to repeat our panel of tests to see what it might tell us. Because, through this whole time, we were wondering if we were prolonging his suffering unnecessarily, and these tests might help guide us. And so what we saw on the second test, which was his second week that he was in the hospital, was surprising. Because when we asked him to repeat words, his language network lit up, like you see here. And when we asked him to move his body, his motor network lit up. And we asked him to do several other things, and we asked him to do them several times, and we asked him to stop do them several times. And so he had to perform this on command exactly as we were saying. And also, as you can see, there was a lot of normalization of the time signal. This is the red graph on the right of those networks. This is an example of the time networks. And so those seizure looking networks nearly resolved, and all of his major networks were now apparent, except he on exam wasn't able to move to command, and still most of his brainstem reflexes were not present. And so the team asked ourselves, what should we do with this information, and should we present it to the family? And there was much team discussion, and including our ethicist was help guiding the discussion. And ultimately we determined that the best thing to do was to discuss it with you all, the family, to help guide the decisions. So I'm going to come back to you guys, and this is during this early period of time, both of you were also at other hospitals being taken care of yourselves. And so then you guys kind of came in, I think, near before and around the time that this new information came in. And I would like to hear from you what your impression was when you saw Eli, what you were being told, how you felt about it, all of these. So I'll just kind of turn it over to you all.
Yeah, I think the first memory I even have of waking up in the hospital was a care conference saying how critical Elijah was. And I was on Zoom. I think my husband was in person. It was a couple of days after the accident.
I think it was a Tuesday or Wednesday.
I still hadn't seen my son. So I hadn't.
I had seen him the night before because I had been discharged in the afternoon. And so I went there at like 6 o'clock in the afternoon, and when I saw him, his tummy was cut open because they had done some surgery to go in there and take a look at it. He was packed. He was swollen. I mean, he was connected to a bunch of stuff. It was a very difficult sight to see. And then being given that information the following morning was even more difficult. Was being told, this is his situation. this is what we expect is going to happen, you know, over the next couple days. You know, these are the decisions we are asking that you please do.
And so let me pause and ask you, what type of decisions were you being asked to think about?
One sec.
One sec. Jeez, Larry.
Funny.
You don't want to let that talk, huh?
No, he didn't.
Is that funny? Oh, here, let me go get a little towel.
We're not good at this Zoom stuff either yet.
Oh, I think it's perfect. It's all just par for the course, really, you know?
All right, can we start again?
The laughter's great. So I think, okay, maybe you could tell us a bit about what decisions you were being asked to consider the information about. What were those decisions?
Yeah, so after we were given the information about how our son's status was, what his, you know, criticality was and what they expected his recovery to look like, there were suggestions on, you know, letting him go, potentially donating his organs to other children who could benefit from them, but
because his injury was so severe.
Because his injury was so severe and everything else in his body was still perfectly intact. But I mean, we know our son, we know how strong he is, and
that MRI really gave us like hope.
Yeah.
When we found out that.
Knowing that information, finding out that information, that there is still a connection there, that he can still see or that he could hear, that's what we needed to know that we wanted to move forward with taking care of him and seeing him along his recovery.
I think my first thought was, if he can comprehend commands, he can comprehend what's going to go on or what's going on right now.
Mm-hmm.
Right.
Yeah, and I might add in, we didn't know that just because he could do these commands within the MRI machine and light that up, we didn't know if that would mean he would still be able to ever show us, you know, through his body, if he would look awake ever and look like he could interact with us. And so, you know, at that point in time, and still to this day in our ICU, we don't have the capacity to be able to interpret someone's commands outside of the scanner. And so, you know, one of the things that we all worried about on the care team side was, well, now we think he's conscious, even though we can't see that he's conscious, this so-called covert consciousness, if you will. But might that mean that if he's suffering, we wouldn't be able to know? And so, and not knowing if he would actually wake up, then the quandary was, how long do you wait? What should we do? And so these were all unknowns at that point in time. And so I would say, like, there we were around, you know, the second week. And how did it go from there for his recovery? What do you feel like he was experiencing that now in retrospect, and what were you all experiencing over that next, say, month in time?
I mean, the first month was really just looking at his eyes and seeing that they would move, I guess. That was really the only sort of communication or contact that we had with him the first month until he got his spinal fusion.
After the spinal fusion is where we noticed a huge difference.
A huge difference was after that fusion. And it might have been because, you know, both because his, you know, spine's fused to his head now, and because there was some repairs done to his dura at the time during that surgery. And that probably helped keep any hydrocephalus from building up and potentially, you know, causing pressure on his brain.
Mm-hmm.
So
when do you feel like he was really first able to, like, clearly respond to you in a way that, you know, someone else could come in the room and see that and know that and be able to, you know, have him respond to them? When did that first start to happen, you feel like, looking back?
A week after his spinal fusion.
So that would have been, like, I think 6 weeks into this.
6 weeks after the accident, I'd say.
Yeah. So for
I would-
about six weeks, maybe what we would see is just a little bit of eye movement from time to time.
Yeah.
Yeah.
Some eye movement. We would see tears coming out of his eye
A lot of
while he
tears.
was asleep, and it was while we were talking to him. So that to us at the time was like, maybe he's listening or can hear or understand us. And when we asked him recently, what's the first thing that you remember when you were in the ICU? He remembers hearing his mom's voice, just talking to him, and everything was black, is what he said. It was just black, and his mom's voice was talking to him.
Wow.
And then you woke up after that, right? Like.
Yeah. And, you know, I might say as the doctor, you know, we're learning, this is all new technology, and he is the first child in an ICU setting to have had a task-based functional MRI and resting state performed at the same time for us to clue in on what condition he was in and treat his networks and then see improvement. This is the first in the world of this happening during the acute phase of the coma. And so, you know, we as his doctors had, you know, great pause in, you know, understanding that this was new and letting you know what our level of certainty was, which was quite low. This is, you know, and doing the best we could with the information. And I think also trying to not inflate the information or let you get too hopeful, you know? And so, you know, on the one side, we know very much that you love him so much, but we also know that we know that you wouldn't want him to suffer unnecessarily. However, if there was a chance, then, you know, we could all look at that together and guide through that information and see where we went. 6 weeks is a long time to not respond, you know, clearly. And we didn't know that after his fusion that it would he be better? We didn't know. And so I think that even understanding that we put him through a procedure that it itself can threaten his life and cause unnecessary suffering. So all of these types of surgeries, I think, were in question as to whether or not we should do them. However, that, you know, we had these tests, I think it helped us understand that it might be worth the risk. Would you agree with that?
Yeah.
I think I would agree with that. I think the first thing the neurosurgeon said to me was, I can do the surgery. I've done harder surgeries, but is this going to better your son's quality of life? I can't answer that question. That was what we were kind of stuck with. But
Yeah. And then, yeah, I mean, you know, the 6 weeks is a long time to wait. But I do feel that maybe if he hadn't had his cutting up his stomach surgery initially when he first got to the ICU setting, he would have been in a more stable position to maybe have gotten his spinal fusion a little earlier than 6 weeks. But because he had to heal and his stats weren't very well and he was, you know, not doing very well, when they tried to close him up, they had to wait that week and a half before they could close him. And that kind of pushed everything out a little bit, I feel. We've read in some situations that there's kids who automatically get put into like a halo or something following a traumatic spinal cord injury like that. And he was C-spine at the hospital for a while, which, I mean, depending on who was there, you know, could be was done appropriately, and sometimes it wasn't. Usually there was a need for like 3 people to move him. And, you know, so I don't know, there's just a lot of different little things that maybe could have been done to, you know, get him to where his recovery was a little sooner. But nobody really knows how to act at that, you know, during that time, and what's right and what isn't until, you know, hindsight. And then you're like, oh, maybe we could have done this and could have done that. And maybe if we would have done this sooner, we would have seen a little more progress.
Right.
You know?
And, you know, and I might say that the standard of care for the level of injury he has is to consider the injury fatal and to not continue care. That is the current standard. That is how serious this injury is. And so this was something of a departure from the standard of care from sort of the get-go. As soon as we started launching these tests and delivering more care and prolonging his care, that we were already into new territory. And so just, kind of bearing all that in mind, that this was a journey for the entire care team into something new for this level of injury in general than the standard. And so I think that, a lot of folks had to think really hard about what were we doing and were we doing the right thing? And it being a new way to think about the whole injury and possibilities that might not have been considered possible before without this type of technology. So maybe we just kind of turn our focus now to what is he able to do now so that the folks out there understand what has he recovered.
Awesome. Yeah, we're excited to talk about that. He's able to use an eye gaze device. He's able to communicate to us by any yes or no question that we ask him. Either Elijah, look up if he's in pain, Elijah, look up if something hurts, or look down if something doesn't. He's able to answer even simple commands even without the technology. The technology just helps him communicate better to us his needs. Mm-hmm. He's moved his hand on occasion. So we're still working on getting some movement back with him. But he's able to eat ice chips.
Yeah.
He's going to be off of the vent for a while when he starts his diaphragm pacer. That's also new technology that's really helped us.
Yes.
So is Elijah still 6 years old?
Are you 6? He says no.
No. Okay, Elijah, are you 12 years old now?
Are you 12? He's saying how old he is. He's saying he's 7.
He's 7. All right. What a big boy. Okay. So, we might talk about, where he is cognitively compared to what we would expect for other 7-year-olds. What would you say about that?
We just actually reintroduced him back to school. So his teacher's been doing at-home learning with him. And she says he's basically at that first grade mark. So technically he's a late starter. He has a birthday in October. So he would have been in first grade. And she says he's kind of right on. He can count up to 100. He can recognize sight words. So these are huge things. He's right where he's supposed to be developmentally.
Yep. When we went to the Kennedy Krieger Institute in Baltimore, Maryland, we did speak to were they neuropsychologists there too? And they did an assessment with him where they had like these cards over him and they would have him pick things that matched in different scenarios, like what came next or what doesn't belong like in this group of 4 items and things like that. And he would have to answer all of these questions and he'd have these exams were like an hour, about 3 days for about an hour. And it was like a test while he was doing his physical therapy and occupational therapy. And the results from that was that he's developmentally normal, like where a 6-year-old would be at the time. So, I mean with
so surprising because his injury included, not just that C-spine, but he had some places on his MRI that there was diffusion restriction in other areas of the brain. So we all kind of held our breath that even though he's following these simple commands that we gave him in the scanner, some of them did require some, thinking through, what kind of words and commands we were giving him. But, they were on the level of maybe what a 3-year-old could do. So we didn't want to, overwhelm him, but a normal 3-year-old, that is. And so, I didn't know, if he would be age appropriate. And it's really surprising to me because it's like he's lost a year of school, but he's still on track, which is, just astounding. I'm just so happy to hear that. Okay, and along the way, you mentioned that there was some, eye gaze device. What do you feel like, with what, describe to us the technologies that he has had access to and how that has helped him and then what technologies you have now, and then what you're looking for.
Yeah, so he actually got to trial an eye gaze controlled wheelchair while we were in rehab. And he drove it up, and at first it was rough, but by the end of our stay in rehab, he was driving it up and down the gym, doing turns. So that, I feel like, could really boost his independence. So we're looking into getting that soon for
A
him.
motorized wheelchair that connects to his eye gaze device and allows him to sort of move with it. Do you want to show him what it looks like?
He can talk while he's also moving. So he can move his own chair, and then he can also say something with the same eye gaze device that he's using to move.
So it's kind of like a tablet that you put in front of him, and he looks at it, and there's like controls on it that allows him to like move his wheelchair forward, back, left, right. He can pick words, make sentences together. So it's just a matter of like any current 1-year-old to learn what those sight words are and then start stringing them together. So I feel like it sounds difficult, but he's still in that stage where he needs to learn how to do it anyway. So this will just be like the way that he learns to string these words together and make full-on sentences.
Wow,
So
well, how wonderful that Kennedy Krieger Institute had that available to him. And, you know, that's something that it sounds like it would be great for us to have here in the Arizona area for children who are going through inpatient rehabilitation as well.
Yeah.
Definitely agree, 100%. I think they're actually working on it for his outpatient. They're going to work on getting him a tester one so he can drive it while he's in therapies while we're waiting for our own.
Yeah.
Because those take a while.
Now, I might just mention here, recently, Elijah got COVID.
Yeah.
Can you tell us what happened? How did he weather that storm?
So our first sign was he just needed oxygen. We didn't know that it was COVID initially, but we were on about 5 liters and he was still kind of sitting really low on his oxygenation. So we took him in and they swabbed him just because they were going to admit him just to observe. And he came back positive. We brought him upstairs and the following day, he was completely unresponsive, comatose. His CO2 was extremely high, and he just his pupils were right back to being pinpoints. So they rushed him to a CT scan, and the CT scan showed that everything was okay. His shunt was still in place and working well, but they did hook him up to an EEG, and they noticed that he did have some seizures. So we did start him on some anti-seizure medication. And then it was just up and down from there with respiratory infection.
Yeah, COVID made his brain basically turn off for a day and a half. And then he just rebooted the same way that it had rebooted the first time, I guess. And, you know, with COVID, it made his threshold for seizures, I guess, a little lower.
And they really can't answer questions for you while you're in the ICU. Like, is my son going to wake up? The neurologist is like, I see no reason why he can't or why he couldn't, but they can't give you a definite, he's going to wake up from this. So it was a hard 2 days. And then he finally woke up and he was back to being himself. He asked for his tablet.
Yeah, first thing he did when he woke up was ask for his tablet. And we're like, hang on, you have.
I was like, you just woke up. What are you doing? But that just shows that he's just a kid. He's just his normal self. And
Yes, ready to play.
yep, ready to play all the time.
Yeah.
How do you feel like his personality is compared to before?
I feel like he still has the same goofy personality. He's always been a really sweet kid. He's still very sweet. He has a little bit more, if I'm being completely honest, anger. Sometimes he gets extremely frustrated with simple things, but it's understandable.
Yeah.
So, but really, he's back to himself. He loves everything that he loved before.
He'll still make the same jokes at the stuff he normally would, or he'll laugh at stuff that he
Same
normally
stuff.
would. He'll say stuff like, yeah. It's just in a different channel, kind of
Uh-huh.
how we would receive that because
Maybe you could give us a little story about, something that shows his personality or something, that happens with him,
so like we love playing video games together, and we'll play Pokemon, like the newer Pokemon games that have come out for like the Nintendo, and we'll pick like certain Pokemon that we know he likes, and then we'll tell him, well, how about this one, which is like a girly one, and he'll be like, no, he'll get mad. Tell him, well, do you want to be like a girl character or are you a boy character? And he'll get mad when you hover over like the girl character.
That's totally a boy's boy.
Yeah.
Does not like the color pink.
Yeah, doesn't like pink. And then we'll name like the bad guys funny names, like Booger Guy or something like that, and it'll make him laugh like a kid would. Like,
Just goofy.
yeah.
Oh, that is so awesome. That is all boy. Oh man. Yeah.
100%.
Wow. I think that, the other families out there whose children are experiencing coma, what would you like to say to them?
That it is tough, and it's hard to see your kid, in a situation like that, but don't lose hope, because at some point they will hear you, they can hear you. You'll just know as like a parent that like your child can understand you in a way that no one else can, because you just, as their parent, have that connection with them, I feel. And maybe Jeanette can, speak to that a little bit more, being with him through everything, and through COVID, because I couldn't be there.
I feel like if anything, in an uncontrollable situation like what's happened to us, one thing you can control is the energy that's around your family and your son. And if you can make that happy and positive energy, they can feed off of that instead of a scared and a negative energy.
Don't
so
know,
just
like,
you can control that.
Wow, very profound. What would you guys like to tell the doctors out there? Yeah, I mean, this is your time.
We love some of them, but we appreciate
others' feedback.
all the feedback we received. Positive, stay positive, and also got some negative, but it's their job.
It's good to see the full spectrum, even though they may not be on the side that we want them to be. It's good to know that is a possibility, and we do appreciate them for that, but we also appreciate them for all the work and everything that they have to do to get to this point. Not everybody's ever gonna see a child like Elijah, but if they can learn from him, I mean, that'd be great.
Yeah. And something I might say is that this is all sort of braced with the objective findings that we had with this test, that we actually had reason to hope. Whereas if we hadn't seen these things, then it wouldn't necessarily be reasonable to expect doctors to give you hopeful information against all odds.
Right.
It would be still good doctors to say, well, we're not seeing, improvement, or we're not seeing good signs. So, just to let everyone know that you all are very reasonable in what you're saying here. I think. Mm-hmm. Yeah. Wow. Well, my heart goes out to all of you, and thank you so much for teaching the world and being a light for other children, and opening up your home and yourselves to us. That it's just a tremendous gift, and I am so thankful. And on behalf of the World Coma Day effort, we are so thankful and just so glad that you joined us today.
We're so grateful for the opportunity, and thank you so much for everything that you've done.
Thank you for the opportunity to share his story and just get it out there, to know that he's here, he's gonna be some cool little, I don't know, like cyborg kid or something in the future. Who knows where our technology will go in 10, 15 years, he could be up and walking.
Yes.
You know,
Thank
this last month was the first time a man with a severe spinal cord injury who wasn't walking now is walking again with advanced technologies, which was published in Nature. So what do I know? What could be possible for him? What do I know?
Exactly. I read the same article. It's amazing. So
Okay, you guys.
Thank you.
thank you so much.